today we're going to be performing an ear assessment. This here is my patient. So first I'm going to go ahead and close the door for privacy. Next I'm going to go ahead and wash my hands and gather my equipment. Okay, so next I'm going to go ahead and introduce myself to the patient. Hi, I'm Meredith and I will be your nurse for today. Can I go ahead and have your name and date of birth?
Catherine Garcia, January 1st, 1965.
Okay, perfect. We have the correct patient. Next, I'm going to explain the assessment. Today, we're going to be performing an ear assessment. Do I have your consent to go ahead and follow through?
Yes.
Perfect. You can remain seated here for the duration of the assessment. And let's go ahead and get started.
Okay.
So first, we're going to start by inspecting the external structures of the ear. I'm inspecting the size and the shape of both ears to make sure they're an appropriate size for this patient and to make sure they're symmetrical. I'm also inspecting the skin condition around the ear and inside the ear to make sure there's no abnormal redness or bumps or swelling, anything that would look abnormal. So they're good. The skin condition is even and uniform on both ears, and both ears are symmetrical. So let's go ahead and take a look at the external auditory meatus, which is the ear canal. And I can go ahead and use the light on my otoscope to look at the ear canal here, checking for redness or any bumps or swelling, any abnormal growths. Everything looks clear and uniform. Next, I'm going to go ahead and palpate the external structures. We're going to start off by palpating the pinna here, the tip of the ear. I'm going to gently pull up on it. Any pain or discomfort?
No.
No? Okay, good. Next, I'm going to palpate the tragus, the inner ear. Any pain or discomfort?
No.
Good. Next, I'm going to go palpate the mastoid process, which is the bony prominence here behind the ear. Any pain or discomfort?
No.
Perfect. There's no lumps, no swelling, nothing abnormal. Both look normal and good. Next, I will go ahead and use the light here to examine the external auditory canal for cerumen, which is earwax. A moderate amount of earwax is normal. However, I will be looking for any excessive amounts of earwax or drainage that might be present. So both ears are clear and no abnormal amount of earwax is present, so that everything looks good. Next, I will go ahead and inspect the tympanic membrane, which is a pearly gray, thin, transparent membrane of the inner ear. I am looking to make sure that there's no redness or swelling and to make sure that it is not perforated in any way. And I will gently pull the pinna up and back when examining the tympanic membrane to get a better look at it. And they both look normal. There's no perforation. There's a thin, transparent membrane that I can see. I'm also making sure to observe the cone of light, which is the reflection of the light on the tympanic membrane. So both membranes look clear and good, no perforation.
Okay.
Lastly, I'm going to use the whisper test, voice whisper test. So I'm going to go ahead and whisper something in your ear, and I would like for you to repeat it back to me.
Okay. 1, 2, 3.
Perfect. Now the other ear.
A, B, C.
Okay, perfect. You repeated them back to me correctly. That pretty much concludes the ear assessment for today.